is a presentation of the Canadian Centre for Abuse Awareness and is brought to you by Freedom from Addiction.
It's Sunday and you're watching Living Clean, Living Well on CTS. So glad to have you along. And the doctor is in the house tonight, Dr. Vera Tarman. Good to have you along again, Dr. Tarman.
Thank you, Teresa. I'm always glad to be here.
Yeah. We've had an awful lot of phone calls over the past couple of weeks, and as I've always told you, we're listening. And we've been finding that a lot of people have had specific questions about specific addictions or points of their recovery. And there's been a lot of time when I've really wished that we'd had a medical doctor that was sitting on the desk with us. So I had suggested to Dr. Tarman heading into this show, wouldn't it be great to do a whole show on Ask Dr. Tarman? And so if you've been saving up your questions, or perhaps maybe you want a different slant or a different take on something that we have discussed in the weeks previous, now's your chance to give us a call. So how are things going? How are things in your world?
Oh, they're going very well, thank you.
Yeah. Your work at Renaissance, it's going well, I understand?
Yes, it's going really well.
I always hate to ask, are you, are the beds full? Because then I know that there's a lot of hurting people out there, but on the other side, we know that people are getting help. So are you busy at Renaissance?
We're busy, but we're not as busy as we can be, and it's probably because it's summer and it's just really nice out and people aren't driven to that, I guess, the desperate measures that they often are. So it's actually a little bit quieter now than usually is. It'll pick up. We get these spurts, and right now we're in a bit of a lull.
Are you?
Yeah.
So I guess if somebody was needing help, then you do have beds available.
Yeah, that's right.
So
that's right.
in that way, that's a good thing as well. We decided as well, we always like to start the show off with a topic, and one that we have not really addressed, we've alluded to but not really addressed, is one of the most powerful addictions out there, and that is smoking. So we thought that we would start things off, even though this is a show generally about addictions and substance abuse. Whatever you need help with tonight, we're here. As long as it's, in the vein of what we discuss here on Living Clean, Living Well, and for folks that are in crisis and needing to reach out. We've had a lot of calls like that in the past couple of weeks, Dr. Tarman. So we're here for you, as we always are every Sunday night, and we'll continue to do so throughout the summer. Some shows take breaks, we don't. So that's always good.
Yeah.
So let's talk about smoking, and it's really, we've said on this show before, one of the hardest habits to break, isn't it?
Yeah, and it's really an appropriate topic to talk about, because even though smoking itself has decreased in the population, like it used to be 40% of the population smoked in the 70s, and now it's 20%. In the addicted population, that's not the case. It's much higher because people tend to be addicted to alcohol, cocaine, and cigarettes. So it's almost a connection there. So it's really appropriate that we're talking about it, even though it is, thankfully, becoming less in the general population.
And I understand, and this is alarming as well, that there seems to be a rise in smoking in the young teenagers.
Yes. Absolutely. I mean, it's really startling to see that at least 1 in 5 kids, like 15 to 17, smoke cigarettes. And we're definitely seeing it across the board, not just with the young, with women, women smoking cigarettes.
Well, there's that weight loss angle to it,
absolutely, and it does help you lose weight. It doesn't help you. It suppresses your appetite. So there's a truth to that. That's where Virginia Slims came from.
Really? They got that makes sense, doesn't it?
That's exactly where that whole thing. It was actually
targeted to women. And I thought it was just because they were skinny.
No, it was targeted to women to be not only sophisticated looking, but also you get this extra benefit. And the thing that's scary with young people is that the younger you are, like 15 to 17, the more likely you are to become a long-term, lifetime smoker.
Wow.
Yeah.
So you've always been very honest. You were a smoker at one time as well.
That's right.
How did you go about coming off of smoking, and what did you do?
Well, I knew that I had to quit because I developed a pretty strong asthmatic reaction to cigarettes. But I didn't want to quit because I was young. I started smoking when I was 16, 17, as so many kids do, because I wanted to be part of the crowd. And by the time I was 24, 25, it was just affecting me physically. And I really, really knew I had to quit and wanted to quit. And the peer group is not as important at that age as it is, as it was when I was younger. But I just did cold turkey. I mean, I was lucky that I had my father, who was a 2-pack-a-day smoker, quit cold turkey. I had a model of somebody who quit, and I thought, if he can do it, I can do it. I mean, it took me a number of months to think about it, but then when I decided to do it, I just went and I did it.
My dad quit cold turkey too, one
Yeah.
New Year's Eve, and then the pack of peppermints with him, went
Yes.
with him wherever
That's
he
right.
went, and
Yeah.
cold turkey.
That's right. And actually, in terms of successful people, if you look at the statistics of who actually has quit smoking, it's over 80% of the people who have quit smoking have quit cold turkey. Now, that's not a large population in general, but of the people who are successfully quitting, cold turkey was the way that they did it. Yeah.
That's an interesting stat. Our phone lines have started already. Shall we go to
Great.
work here?
Yeah.
Not that we're not already working, but and my directors just told me that they're going to be working on getting that call back. So let's carry on with our discussion on
Okay.
smoking. We all know, we're told, and we're given so many reasons why we should quit smoking.
Yeah.
What are some of them? I mean, as well refresh our memories.
Well, I mean, in terms of the cause of death, for a long-term, like a chronic smoker, there's a chance, between a 1 in 4 to 1 in 5 chance that you will die of smoking-related illness. Like, it's just, you're really asking